Hey YouTube, and welcome to the MC's Unscripted, where we talk to artists, entertainers, and behind-the-scenes decision makers who are some of the best at what they do. So today we have something a little special for you guys. So for a long time now, you may have noticed that we've been focusing on music and wellness. You may have seen on one of our previous videos by Bryant Larson, he talks about music and the curing of Alzheimer's disease, fibromyalgia, and cancer. And obviously, so we are musicians and educators on the channel. So today we wanted to talk to a panel of professionals to ask you guys, did we get it right or not? So first we have winner of the Brains 500 Global Award, author of Building Confidence for Kids, Taking Care of Me, and My Gratitude Journal, also a certified youth mindset coach, Ikeda Alston.
Thank you so much for having me.
Of course, thanks so much for joining us today.
You're welcome.
Next we have Dr. Edwin Tulloch-Reid, a renowned cardiologist, and who's also a fellow of the American College of Cardiology and on the Medical Council of Jamaica. Hi.
Well, sort of, I guess I'm bridging both worlds.
Yeah, exactly. Next we have his beautiful wife, Katrine Tulloch-Reid, Chief of Health and Wellness Learning, and one of the founders of My Heart Wellness.
Thank you. Hi.
Awesome. So, before we get into watching the video with you guys, can we start with Ikeda? Can you tell us a bit about being the owner and founder of Kima Kids Life Coach and what that's all about?
Yes. Well, when I first started my journey as a coach, I started off being a youth life coach, and I wanted to go that route because in my parenting journey, I do have two kids, 11 and 14. I've seen a lot of things in them that I really wanted to embrace and to encourage and motivate. And, thinking back to my own childhood, I did not have the best childhood, and I did not want my kids to have the same experience, the same negative experience that I had with low self-esteem, low self-worth, lack of confidence, and things like that. So when I decided to go into to youth life coaching, the philosophy that I wanted to bring about during that time was be who you needed when you were young. So I felt like if I had someone like me when I was younger, maybe I would not have had the negative experiences that I had when I was a kid. And so, 2 years into that, I've decided that, okay, well, in order to, I put it in the analogy of a plant. In order for a plant to grow, the surrounding area, the environment has to be, nourishing and fulfilling too. And so I equate that the soil and the environment to the household. And in order for that household to grow, full and lush and all that, I feel like the whole family needs to be involved in that. And that's why I also became a family coach.
Wow, that's so beautiful. Thank you for sharing that with us.
You're welcome.
So next, Katrine and Dr. Edwin, can you guys tell us about myheartwellness.com and what you guys do?
What we do in a nutshell, we teach people how to change their lifestyle and reduce their risk for heart attacks and stroke. And we do that through an online program. I'm actually a cardiologist. And as you said, I trained in the US, and I was actually on the sort of interventional side of cardiology, on plugging arteries, putting in stents. But you can have a lot greater impact if you teach lifestyle change. 80% of heart disease is preventable, and we know how to do it. But actually, we know what to do, but it's not so easy to get going with doing it and to make those lifestyle changes stick. So we developed this program. Most of it happens in the mind. And Katrine's an expert on mindset change. She can tell you the rest.
Yes. So what I experienced was that it's all well and good for a patient to sit in their doctor's office and they receive the instruction, do this, do that, eat well, eat more vegetables, cut down the salt, get more exercise. And then the patient leaves and is very unsupported on making those changes. And as we all know, the way that we've been living our life is what we're accustomed to. And so in talking, how could we not only focus on the prevention of heart disease and stroke and heart attacks, but what did we need to be able to offer to someone to really help them along that journey? And this is where we came to sort of designing the programs. This is my area of expertise, is designing the programs so that it's not only what somebody learns, but it is also then that they have the tools, they have the skills in order to make those changes in their life. And very importantly, that those changes can stick, because that also is where the benefit comes. It's, the little point in doing a great physical activity exercise regime for a week, and then it stops, right? And so it's how do we incorporate change into someone's lifestyle in a way that is not stressful, is very doable, is very manageable, and in a way then that, the person can continue with, and it becomes a new way of living in life.
Yes, it's a journey, and we support them on their journey. We provide the support they need to enjoy the heart health they deserve.
Wow, that's amazing. Well, I am honored to have you guys on the show, really. So now why don't we get into the video?
Meet Diobeth, or Dio for short. He's your perfectly normal, happy, healthy 15-year-old boy who finds every reason to hang out with his friends, does his chores, but football, that's his thing. You can ask him anything about the Seattle Seahawks. Let's go 12 man! And he could tell you anything about them, from who's on the bench, to the roster, to the salaries, anything. At least he could at the time of this picture. You see, 2 years ago, Dio went from being able to go to football practice strong and healthy 5 days a week, a game every single Friday, to losing the ability to even open his hands, practically overnight. And that was just the beginning of it. Days pass, and Dio and his parents realize that something is terribly wrong. It's more than just a lingering football injury, and they go to the Children's Hospital Los Angeles to discover what is actually going on. Our friend Dio has a mass sitting on his brain that is affecting his motor skills and maybe more. Even though the doctors were able to perform a successful surgery within 3 days of his diagnosis, during his recovery, his body began to act unexpectedly. Besides the pain he started to feel, his blood pressure spiked along with his heart rate. Dio had a stroke. And now what started out as a successful surgery, promising help, ended up being a complete loss of his ability to communicate. Not to mention the loss of nearly all motor function, confining the once football player to a wheelchair. So what happens next, YouTube, is the reason why we're here. You see, Dio taught himself how to play the guitar and the piano well before all of this ever happened. He could play all of his favorite songs, and it was something that he loved to do. So once Blake, his rehab specialist, learned that singing and music were areas of strength for her young patient, she began incorporating music into their sessions daily. Dio, now affectionately known as the Ed Sheeran of Children's Healthcare Los Angeles, showed amazing progress. How did this happen?
So I'm pausing it right now to ask the question, do you think that learning can be a form of preventative care for diseases such as Alzheimer's or other such cognitive diseases?
Well, actually, that would have to be something sort of looking back into the past to do that kind of study retrospectively. It couldn't be what we call a prospective trial, which is generally carries more weight in terms of evidence. So it's hard to say, but it has been theorized that people who are exposed to music, and I guess more than just listening to it, but because there's nobody who's music naive, music is all around us. but it's more maybe participating by learning an instrument or being involved in maybe in dances related to music, that their cognitive function they tend to maintain their cognitive function, and they seem to be less susceptible to neurodegenerative diseases like Alzheimer's later in life. So it may have a legacy effect, long-term effect, but it's really hard to tease out because there's so many factors involved in one's brain health, so to speak.
Okay. And Ikeda, do you have anything to say about maybe the therapeutic side of music for recovering emotionally, on the emotional side of things?
I guess with all of the things that you guys have said, I believe that those are some really valid points. And I also know that in my research of emotional intelligence and emotional wellness, music does play a part of developing the neural pathways, and connecting all the synapses in the brain are firing whenever we're exposed to music. So I think that when you think about it on that aspect, it creates a calm body, a calm mind, and a calm spirit. And our bodies respond to stress. And when our bodies are in stress, it's hard for it to heal. So when there's something that is calming our bodies down, like music, I think it can be a huge factor in helping our bodies to heal on that side, on the opposite side of the clinical part of it. So yeah, I definitely agree.
So I think one of the things that I find very fascinating about the effect of music, and this particularly is found in those that have been learning to play music over a long time, is the way that it strengthens the connection between the right hemisphere and the left hemisphere of the brain. And we know certainly also from some of the studies from sort of the aftermath, for example, of something like a stroke, where there may be impairment, for example, in a certain part of the brain, but how the brain, now we know that the brain is incredibly, what's the word?
Plastic.
So that it has this ability to recruit function from other parts of the brain. And it seems that this could be in part where the connections between both sides of the brain might facilitate, if the damage is on the left side, is that perhaps some of the function can be co-opted, as it were, from the right side of the brain. But it seems that this connectivity that is facilitated, and we know from the imaging just how much of an impact prolonged learning of music makes those connections so strong. I think that is also it's early days. And the imaging is also developing. And so we can see so much more now of what's actually happening in the brain to understand some of the mechanisms, or at least to hypothesize it of an explanation.
Okay, yeah, and actually, from when I was taking piano lessons from a young age, I heard, my piano teacher said that piano was the, I don't know if it was the hardest instrument to learn, but you use both sides of the brain because you're using both of your hands doing different things at the same time. And so I always thought that was so interesting. And whenever I told anybody I played piano, I was like, yeah, it makes you smarter.
Better at math? Not sure. Okay.
Yeah, there is actually math in music theory. So I did pretty well at that atonal math, but that uses numbers, things like that. So yeah. We'll go, does anybody else have anything to add, or we'll go back to the video? Okay.
What role did music play in any of this? Many patients with aphasia can sing more than they can speak. That's because music is one of the few things that crosses both hemispheres of the brain, helping to create new neural pathways for language. As a matter of fact, later in this video, we're going to explore experiments that prove that music and sound frequencies can have a physical effect on the body on a cellular level. So it's no surprise that an entire industry is being built on the foundation of a single question. What else can music and sound itself cure in the human body? Hey, my name's Bryant. Welcome to the MC's Music at the Core Everything. Today I'm your host, and we are asking the question in this video: can music cure cancer? The answer is nah, music cannot cure cancer. It just can't. Nobody has a cure to cancer, right? Let's come back to that. What about heart failure, fibromyalgia, Alzheimer's disease? For those families affected by Alzheimer's disease.
Okay, I'm going to pause it here because I wanted to ask a question before we get all into the Alzheimer's disease. I want to ask, so can music help prevent or recover from heart failure? Dr. Edwin, what do you think about that?
Well, there seems to be evidence that there's benefit, but as he said, there's a difference between healing and a cure, and healing may involve a lot of quality of life improvements. So people have a better acceptance of their disease and what's wrong with them, and they actually feel better. They're more able to do their normal activities, the activities of daily living. So in that sense, there's a quality of life improvement, and there seems to be demonstrated benefit in heart failure and music. But it'll be very individual, because there are generally certain frequencies which are better for entraining the heart or synchronizing the heart. So it might depend on the kind of music, the tempo, and people also differ in terms of it's a very subjective experience how people relate to particular music. So what might be music that somebody likes, another person they may not like it. So it probably is a very individual thing. But there seems to be benefits. Now, there are risk factors that lead to conditions like heart attack, stroke, and heart failure. And we know a lot of them, like hypertension. And music has actually been demonstrated, maybe listening to music about half an hour a day to reduce blood pressure, to reduce heart rate. The heart, there's the heart is controlled by the nervous system. And there's a sort of a yin and a yang, a sympathetic, a fight-flight response, and a rest and digest response. And music seems to alter the balance in favor of the rest and digest, the slower heart rate, the calming effect, and that has benefits for the heart. Even with people who already have disease, already have heart failure, who've already had a heart attack or a stroke, there are benefits for them for the long term. But it's not the cure, as I say. It can't restore you fully, but it might improve your quality of life. It may not even necessarily lengthen your life or improve survival, but there seems to be quality of life benefits for music and in the cardiovascular system and in cardiovascular disease.
Okay.
Maybe there may be some survival advantage if you listen to music, one listens to music consistently, because of the benefit it seems to show with anxiety and depression and actually mood in general. So, those have prognostic impact, as we say in cardiology. So music can help you that way, and it's your kind of music you like, music maybe that you can dance to. It facilitates becoming more physically active, reduce your stress, music that allows you to sleep better. And these are all major pillars of heart health. So it would seem, at least on theoretical grounds, that music will benefit people who suffer from these conditions, and may even, because of these important risk factors, help prevent a lot of these conditions. That's where we're all about at My Heart Wellness, preventing. And then preventing doesn't mean that you prevent someone from getting the condition, but you can have something called secondary prevention, prevent complications of the condition, or tertiary prevention. So heart failure is a progressive illness that people tend to get worse and worse until they die. If you can prevent that progression, that's very helpful in terms of people's outlook. It's someone who's suffering from heart failure in terms of and maybe 1 million people in the United States at this moment actually live with heart failure. So it's very real, it's very common, and anything that will help them enjoy a better quality of life and live longer is beneficial. Music and any other mindfulness practice, we would recommend and support.
Awesome. Ikeda, did you want to add anything to that?
Yes. One of the things that you said earlier, Edwin, made me think about about my dad's situation. You said that it's subjective, as far as how you are when you accept the diagnosis of your disease, and you said it's subjective and it's based on yourself, and it's also based on your surrounding areas. So it kind of led me to ask the question of like, I wonder how does like age and gender and like people's cultural background, how does that impact the health benefits of music?
But as you mentioned, music is very different, and one person's music, one man's meat, another man's poison. One's rock music. But generally, we found interesting. There's a study in West Africa, in Nigeria, where they looked at blood pressure lowering and heart rate lowering in a particular province in Nigeria, and they compared different types of music, and within their cultural context, R&B music and reggae were the most effective at lowering heart rate and lowering blood pressure. So, as you said, if we have to understand the background culture, whether it's maybe more of an African culture, they may respond more to music, maybe it's generalizable, I don't know, but a slower tempo and a higher frequency. And that, it's believed, also helps with things like eating choices. So we talk about healthful living as one of our pillars of health, but eating choices you make better eating choices if you listen to slower tempo, higher frequency music compared to sort of the opposite, faster tempo, lower frequency music. So music has a tremendous power to influence how people think, how people react, how people behave, and change their whole mindset. And therefore, even with disease or even with living disease, it can completely change your outlook. I think it's a very powerful thing.
Like I'll speak about my dad. He did pass away about 4 years ago due to pancreatic cancer. But the way that he accepted the diagnosis of his disease, it wasn't very positive. And I wondered if the progression, like the way that his progression got worse so quickly, was because of his acceptance of it. And if there was, if there was a way to slow that progression, like if he was in a better overall emotional, his emotional health was more positive, or maybe he had listened to music, would it had, maybe slowed down the progression of the disease? Or, it just leads me to ask all of these questions now, because it's so like, it's really phenomenal how music can affect people's minds and bodies so differently. So yeah, I wanted to throw that out there, because I thought it was amazing what you said, Edwin, earlier about it. The acceptance of the disease could possibly slow down the progression of it. So yeah, I just wanted to add that.
I'm very sorry to hear about that, but it really, pancreatic cancer is not a nice thing. Well, we know from cultures in Africa and in the Native American culture, music is very much a part of healing. And as I mentioned, we're talking more, not so much about cure, but about healing. And part of healing is acceptance. And sometimes recognizing that one will not necessarily get better, but there are things one can enjoy while one is alive, and, being able to relate to family members and being there. So you can, the positive aspects. There's also an issue of what we call a sick role, that people assume a role which is sort of marred in depression and anxiety and helplessness. And if music is felt to actually help people relinquish that role and be able to function better emotionally and maybe even physically and in other ways too, because of this calming, healing effect it has.
And we also know the reverse is true, that music which is either very loud, it's music that maybe grates on us, or music which has where the beat is very, very persistent and insistent, and it's faster than our own heart rates. We get trained to that. The body can experience that as a very real stress. And so again, you have to think about, when we talk about music, it is that very broad spectrum. Maybe a question that we should ask is, what are we talking about music? Is it music that's just man-made? What about like the music of nature? We're admiring Ikeda's beautiful background, and I'm sure we can all experience that. We can kind of exhale just looking at the serenity of the plants and the trees. There's also a sonic landscape when we step outside and we open our windows and we go on our balcony, and what are those sounds, and what are our associations, and what are those frequencies, and what is the rhythm that's established there? So think of, the developing fetus in a womb, and what is the sound that is constant? It's
the reggae beat.
And so, it's when we hear that kind of rhythm, is it that we are recalling at our most fundamental, deep in the recesses of our, primeval brain, a safe space. So, you can think of what we're reacting to, and it's part of it can be frequency, as the study that's cited. Part of it can be just the regularity, because again, we know that we find it more less stressful if there is a predictability and there is a rhythm that's understandable. So changes to that can also make us feel stressed. And so we think that the power of music is at a very deep instinctual, that it really is something that we react to, and then we process it afterwards. We think, oh, that's a beautiful melody, or I was moved to tears by those lyrics, or I just wanted to get up and dance. But those are the things that we think about after. But our initial reaction is so fast to music that it is before the brain, the cognitive parts of the brain can catch up.
Wow. That I learned so much just now.
So did I.
Thank you for watching part 1 of our 4-part series, The Emerging Research of Music in Medicine, a panel of medical experts. Parts 2 through 4 will be available in the coming days, and when they arrive, the links will appear right here on this screen. You won't want to miss a minute of this amazing hour and 20-minute long discussion with this panel of medical experts, and the groundbreaking research and ideas we uncovered. Thank you for watching the MC's channel, music at the core of everything. See you in part 2.